In the warm tropical waters of the South Pacific lies an archipelago of almost 1,000 islands and atolls. This is Solomon Islands, a country known for its friendly hospitality and rich biodiversity. And while the people who call this nation home enjoy a culture rooted in community and tradition, they also face significant challenges. One of the biggest can be found in the country's healthcare system.
We all know that the health system here is under considerable pressure, so the country really needs as many good doctors as possible.
We don't have enough doctors, and that has been a long-standing issue for the hospital.
Medical degrees are not available in Solomon Islands, meaning eager young doctors must receive their training abroad. Many students will relocate as far as Cuba, while others will travel to neighbouring countries like Fiji or Papua New Guinea. But when they return home to work, there simply aren't enough specialists to provide the training and supervision they need to become qualified doctors.
I studied medicine in Cuba for more than 7 years.
Having studied in Spanish and then I have to come back and then translate everything to English, and work in a local context is a little bit challenging for us. So I needed more practice, especially with practical procedures.
Here in Solomon Island, they want you to be competent so that you can handle everything.
The Cuban medical trained students, these are graduates who come from less clinical exposure. So then we have this challenge of how do we integrate them. So this is where we asked AVI to come and help support us.
Enter Simpler, the Solomon Islands Medical Partnerships for Learning, Education and Research, an initiative designed to strengthen the capacity of the local medical workforce.
Simpler is a program that was developed in 2015 to help the transition of the foreign-trained medical graduates into the internship program here in Solomon Islands.
It is a medical education program which is being developed by the National Referral Hospital from the Ministry of Health in partnership with the Australian Volunteers International.
Through Simpler, we're able to identify senior Australian volunteer doctors who can come and mentor and provide support to those new doctors as they transition back into the hospital here.
You have to do your bridging for a year and then you do internship for 2 years. So you have to build up your good relationship with your consultants and the registrars. Most of the time, they are the ones who teach you everything.
They get to learn from each other, they get to learn the skills, and also the Australian volunteers, they get to learn about the culture here in Solomon Islands.
This partnership is so important because everybody is bringing something different and unique to the table. And I always think strong partnerships bring something to the table and all partners take something away. And I think that's what we see through Simpler because it is about that relationship.
These links that they build, it does not stop here. If they still have questions, they can always reach out to the professional networks that they have developed through the program.
With this ongoing relationship, I have good communication with my previous registrars who are now consultants in Australia. That has helped us a lot in terms of managing difficult cases.
It's important to maintain this relationship with AVI. Medical care changes, the new technology coming in, and Simpler can help in harmonizing this with the local context.
I think it's important for developments to be locally led in terms of sustainability to ensure that whatever is introduced is able to be embedded into the local systems that have already been in place.
We can play a supporting role, we can contribute, but if development isn't owned and led by the people of Solomon Islands, frankly, it kind of peters out.
I don't think we're going to be dependent forever on outside support, and I think the more local capacity we develop and build, the better for us.
We've seen a lot of improvement in our health services. There's reduction in referral of patients from the islands, which also reduces the cost to the Ministry of Health.
The program actually helped me a lot, gave me a lot of confidence.
When I started to work here, there was only about 20 doctors in the hospital. Now there's over 100. And I'm very hopeful that this will develop to a level in which doctors are well trained, there are better facilities, and that patients will receive much better specialized care.
Through Simpler, Solomon Islands is building a robust medical workforce, one where every adult and child can access the basic human right of quality healthcare services. Change that's locally driven and sustainable. That's change that moves us forward.